It's a real pleasure to be here in this conference, and what's been very fascinating, of course, is this morning you've had a perspective very much from the criminological, from the offending field, and this afternoon my perspective has always been across the fields, and I'm going to be taking it from a more child protection perspective. Can I point out that in your packs you have two documents which I think are relevant. One of them, this little blue document, which describes our Hope for Children and Families program. It's really pretty hot off the press, so I hope you'll find that interesting. And the other is a single sheet, which is the Hope for Children and Families, an intervention resource pack for practitioners, which is what we're talking about today. And on our stand, you'll find an invitation to some free regional seminars. Our presentation today is, in a sense, a prequel to the day conferences that we're running in Liverpool, Sheffield, Cambridge, London and Birmingham between the 19th and 27th of November. They're free conferences, so you're very welcome to attend, and I hope that I will have whetted your appetites today, so you'll feel you'd like to come and hear more. So the theme is the Hope for Children and Families program, resources to help professionals help children and families. The aim of my presentation today, and it's linked with the presentation that Sarah Morris, who's here, is going to give immediately afterwards, which relates to the work, particularly with the intervention approach, which we're going to refer to. So, where the context is the eradication of child sexual abuse, and this is part of a number of conferences which we at Child and Family Training, together with our partners with the Faithfull Foundation and others, have put on, looking at the eradication of neglect, a general approach, and now of sexual abuse. And I'm very pleased to say that, that very shortly, a book which Jenny Gray and myself have edited, relating to our first conference on eradicating child maltreatment, is going to be published in September by JKP, which will really bring together the presentations that were given then, and including one from Donald Findlater, who you heard earlier today. So we see this as an important theme which we want to carry forward, and I'm delighted that the Faithfull Foundation has led, together with the Oak Foundation, on eradicating sexual abuse. So that's the theme we're talking about. I want to talk a little bit more today about secondary and tertiary prevention. The research context for the work which I'm presenting today is the work to prevent the recurrence of abusive and neglectful parenting and the associated impairment of children and young people. This is the evidence base which, from the perspective of child protection and the context of abuse within family and near context, this is the research context that I'm speaking from, compared to the research context from the field of offending, which we've heard today. And it's interesting to see how these two come together. Of course, we know that there's a difference between sexual abuse and other forms of sexual maltreatment, because abuse not only occurs within family context, but of course we now know about this increasing network of peer-on-peer abuse and exploitation, which Sue Gorelovich spoke about today and which was spoken about otherwise, which makes sexual abuse rather different and therefore needs a broader approach. So we have to consider abuse within family context, and of course what makes children vulnerable. And then we have the whole of the development of the internet as a process which enhances and makes abusive action even more intense and vivid, and occurs in an ever-increasing circles. And we're looking at that this afternoon. So that's what we're talking about. I just remind you of this very classic image of the framework prevention by Macmillan and colleagues in their classic Lancet article in 2009. And I have to say this is the absolute iconic paper which brought together the research in this field, which we have used as a profound basis for our work. And this process describes prevention before the occurrence of abuse, targeted and universal approaches, which we've heard about, prevention of recurrence, and the prevention of impairment, which of course leads to the long-term outcomes. And it's very fascinating to look at the NSPCC research on the cost, very important theme in addition. So that's the background. Now, the one piece of research which actually has moved us towards the idea of eradication is the research of Ron Prince and Matt Saunders and colleagues, which we presented at the first of these conferences. And they described a very interesting slight variation, because you've had this morning the idea of the different levels of primary, secondary intervention and the context, very valuable model. What they introduced, I think, was another interesting linked model, which they call the blended model. So what they were saying is that really we have to bring together targeted approaches, so parents in an area of need, universal approaches, targeted approaches to vulnerable individuals, vulnerable children, vulnerable families, and which results in a tiered, multi-level system. Now, the Prince and Co., that particular study was carried out in one of the American states, and they did this study, a statewide approach of providing universal parenting at multiple levels, a media and communicational strategy, brief parenting advice, narrow focus parenting skills, focused and skills training, intensive family intervention. This idea that what an eradicating program looks like will include broad-based approaches across the whole population, and then increasingly targeted approaches. And that particular approach actually demonstrated a definite reduction in the rate of new child protection cases within the particular state. That has not been repeated, that study. And it needs to be repeated because we need evidence that we can make a difference on a population level. So, what's our contribution to this? The Hope for Children and Families program, at the present time, as we know, our government is very interested in how can we make systems changes in the way that child welfare services are actually delivered. How can we make them more effective, more targeted? How can more children and families be helped? And our notion is that a valuable approach which we feel could help, as you know, child and family training has been, for the last 15 years, has been, 15 years next year, 15 years, has been concerned to introduce evidence-based approaches to assessment, to analysis, and now to intervention. And we've trained many practitioners across many different contexts and many different parts of the country. We feel that it would be valuable to bring that together as a program to help make whole system changes to the delivery of children's service. And in terms of secondary prevention, in other words, prevention of those cases which are coming into our knowledge, where we have to begin to prevent recurrence and prevent secondary impairment, we need a broad-based approach to assessment, to analysis, and to intervention. So that we're aimed at organizations and staff working with children and families to support and enhance the quality of direct work by introducing evidence-based approaches linked with good quality practice. And so that what the program consists of resources for assessment, analysis, planning interventions, and reviewing progress, and provides an evidence-based model of practice. Now, in your little blue handout, you'll see a detailed approach to how we think this could be possible. But basically, the framework which we're putting forward, which you must see as linked to the framework you heard this morning, is to say that we need to think about that when children come through because of levels of concern, we deem that they're really in need, that they and their families are in need of early help because of the nature of the problems, that we have children with disabilities and other contexts, which means they're children in need, or we're in a context of child protection, or of course we're in vulnerable children looked after. And I think what we're putting forward is our program is that using the assessment processes, the analytic frameworks, and the interventional approaches, it's possible to design and tailor-make a set of approaches to assessment, analysis, and intervention which will empower practitioners to really provide more effective intervention, protecting children and making a significant difference to outcome. We have to put this in a context of time. So we know that we need to think about the stages of intervention, identification of harm. Then we obviously have to identify situations where we need a full assessment and full information. Other situations where we believe there's harm and we have to establish the levels of harm. We have to make an analysis of the safeguarding context and the likelihood of harm occurring and the opportunities for intervention. We have to have a decision-making approach. We have to develop a plan of intervention, and we have to identify outcomes and measures. That we need to think not only of the context, but a process over time. So that's a very brief account of what we're trying to achieve through our notion of a hope for children and families plan, to give positive hope for the families and children that we're working with, and obviously allied that with the practitioners who we hope will be empowered to deliver better quality interventions. So let's move to the level of the Hope for Children, the modular systemic intervention, which is going to spend the rest of the time speaking about. And you can see on the desk here the two basic resource packs which we've developed, which I'll speak about in a bit more detail. So the research background of this whole approach to intervention is to say that there are two key elements which we need to identify. There's the idea that if we look at interventions across the field of child maltreatment, if we look at all the studies which were described in Macmillan and the paper I referred to earlier, we can, and this is with an approach from Bruce Chorpita and his colleagues at UCLA, we can say that if you look across the field at gold standard interventions, there are elements in common across the different approaches, whether they're systemic, whether they're CBT, whether they're dynamic, educational, that actually within these good quality interventions there are common elements which we employ and which are employed. So if we could define that as common elements, though from those distinct specialist treatment protocols, we could put together an effective intervention which brings the best of the approaches which we have currently available. The other element is that of common factors. The personal and interpersonal components of all interventions, independent of approach. We know that across the psychotherapy field that if you make an alliance with your client, that whatever approach you use, it's going to be effective. If at the same time you ally that with a level of expectation of change, then you get an even better result. And this can be dynamic, it can be CBT, that the interpersonal elements of work matter a great deal. So you need to, but we feel it's good to ally both the notion that we create a sense of hope in the children and families we're working with, and we offer the best quality interventions allied with it in terms of what we do. So that's the idea behind this particular resource pack. So the research background, we studied the 26, please note, gold standard studies from the research literature on preventing the occurrence of abusive and neglectful parenting and the associated impairment of children and young people's health and development. These are the random control trials. But of course, we looked at physical abuse, sexual abuse, emotional abuse, neglect, and exposure to violence. But of course, the literature is terribly patchy. So we also had to take consensus studies where professional practitioners have come together and tried to identify what is going to be what works. But they were subject to a distillation process to search for common elements, and the 46 practice elements were identified across the field. They ranged from the extensive use of psychoeducation, confronting abusive behaviour, confronting the negative perceptions of children, positive parenting, providing good quality care, promoting secure attachments, supporting young children and young people's development and recovery from abuse. Those are the sorts of elements I'm talking about. In other words, they are practice elements which we would all recognize as being relevant and important. In the sexual abuse field, we focused on research on interventions with the victims of child sexual abuse, including the papers on trauma-focused cognitive CBT, the psychodynamic work from Judith Chow and Izzy Colvin, our colleagues from the TAVI, and also young people responsible for sexually harmful behaviour, including work with younger children, the CBT models. And as we know, in the field of working with young people who are sexually offending, the multisystemic approaches are the ones which have been most extensively researched, and we've had to rely on consensus work to fill the gap. Because we were working with frontline practitioners, unlike some of the work we were discussing this morning, we were not including work with adult offenders, because we feel that an approach which we want to empower frontline practitioners working from early help to child protection, this whole range, really the working with adult offenders will not come within their purview. And I'm sure that there needs to be very strong links with agencies, specialist agencies, but that's a specialist task. So, victims of child sexual abuse. 15 practice elements were targeted at children, 6 at parents. So the key ones were psychoeducation about the impact of sexual abuse, cognitive behavioral skills in managing the exposure of traumatic thoughts, feelings, and behavior, relaxation skills, and parents were provided with psychoeducation, coping, and parenting skills, providing tangible and positive parenting capacities. As far as the young people responsible for harmful sexual behaviors, 11 practice elements were targeted at children and young people, 6 at parents, including CBT to help children and young people manage harmful behavior, develop personal safety skills, anger management, and line-of-sight supervision, thinking of the context of this morning. A group of experienced practitioners, including colleagues from the Faithfull Foundation, our former colleagues at Great Ormond Street, Faithfull Foundation, Sway, colleagues who are here today, we integrated those elements with what we saw as best practice to develop the resource pack. So that the Hope for Children and Families resource pack provides an accessible set of evidence-based approaches and resources and tools for direct work. They're available in hard copy, online, including practitioner briefings, modules that can be linked together to plan a work program, tools and instruments. And we're training this in 5 pilot sites at the moment, and the whole training approach is developing as we speak, so that this is very much a work in progress. So it's not, I can only in the time perhaps talk about 1 or 2 just briefly, but for example, one of the key modules which we brought together is promoting safety for children who've been sexually harmed within the family or by trusted members of the community. Such a powerful term. So the focus is on the protective parent. So there are modules to brief practitioners, because we, in our experience, practitioners have very limited knowledge about sexual abuse. Modules to work with parents, establishing the parent's story, psychoeducation, understanding what the sexual abuse of children is about, understanding the process leading to abuse of children, understanding the impact on the child, establishing open communication between the parent and child. How do I talk to children about sexuality? That's a key aspect for parenting. And formulating a safety plan. This is just one of the worksheets. Word storms, establishing open communication. Again, other ones, using body maps. And then an important element, which is spotting risk indicators in others. People who spend more time with children than adults, singling out a child for favours, giving money or gifts, taking opportunities for physical contact, seeking opportunities to be alone, using sexualised language, age-inappropriate personal remarks. So this is all part of the work for parents to protect such children, as well, of course, as the work specifically with the child themselves, helping them deal with the traumatic impact. So here's another one which I'll finish with, is working with parents and carers to support work with children responsible for sexually harmful behaviour. What's been extraordinary in the pilots is the practitioners from various contexts of work, youth offending, work in supporting family support, family intervention, is the number of families where there is some form of inappropriate, sexually harmful behaviour that's not being addressed. So we feel it's essential that practitioners really take on board how do we work with parents and carers to support work with children responsible for sexually harmful behaviour, developing and implementing a safety plan, learning about differential of normal sex play from harmful sexual behaviour, tailoring interventions to young persons' strengths, encouraging children and young people to follow privacy and sexual behaviour rules, maintaining a positive environment and positive relationships with the child. In a sense, the development of the arguments from this morning about making sure that the context of care is a safe one. So I hope that gives you a flavour of what we're trying to do in terms of training frontline practitioners right across the social work perspective and linked colleagues in being able to recognise and to work with and to become familiar and comfortable working in the field of sexuality and sexual abuse. So,
thank you very much.